lot of good news here, but in that White House report, they did rank Oklahoma the 5th highest rate in the country for record new cases per 100,000. I just wanted to get your thoughts or response on that.
Yeah, you know, there's tons of ways to look at those positive cases, and when I saw that, I certainly was calling our health department to find out where they're getting that data, because I would encourage the media, and especially the Daily Oklahoman that printed that today, to look at Johns Hopkins, because that's the positivity rate that we track, and we're nowhere close to number 5th in the country. So that's one thing that we're going to make a phone call to the White House to find out exactly where they're getting their numbers. But I would encourage the media to look at the Johns Hopkins positivity rates, has us much lower than that. But we look at that, and if you think about the positivity rate, that's all that tells you is how many tests are taken and how many are positive. And so really, there's multiple things we have to look at, and positivity is one thing, but that also can be manipulated a little bit with when you're driving more specimens taken through, especially through just asymptomatic people across the state. You also have to remember, I think it was right after Labor Day that we added in the antigen test. Before, those were all in a different category. We've just since added those into our positivity cases, and we've had those as, what were they? How did we classify those? Probables. Those are probables up until we changed some methodology, because the antigen test, remember, we've sent out 200 antigen kind of fast tests to our nursing homes across the state to make sure that they have exactly what they need to be able to test their population within 15 minutes. We're getting more of those out, so we need to bring those antigen tests into our positivity numbers.